Let's begin with the simplest and most pressing question on everybody's mind. Nearly 3 years after the release of OpenAI's ChatGPT, what are our thoughts on using generative AI for mental health support?
Hey, is it good? Is it bad? Does it help? Is it going to harm? That's the question. And my number one answer is let's find out. Just let's find out. It's an empirical question. So, generative AI for mental health creates a desperate need for research, and it creates a completely new possibility for research at scale because you have these 800 million people using ChatGPT alone. If it's 3%, if it's 30%, that's anyway between like 20 and 200 million people using this. They're using it anyway. I hear so many profound stories of people's lives being improved or changed and turned around with this technology. And I hear a lot of fear from people who aren't using it about what it might do to those who are using it. And I hear very few cases of people who are actually harmed by it. But I don't see a magnitude of cases that would be consistent with the magnitude of new use that we're seeing.
So in terms of the gap of having access, there's not enough humans to do the work. So this is a real benefit if it can work. But the way many physicians ask this question about AI, will I be replacing my function?
There is a sizable portion of the population that does not and will never buy into use of AI for their mental health. If all psychotherapists treated were those folks, there would still be long wait lists and still be an access problem. So I both think there's a huge opportunity here, but there's a lot of things right now that are experienced as helpful when I think experts would actually consider them harmful. And so an ongoing behavior of a lot of generative AI right now is they're immediately affirming. And a lot of the things that are actually long-term benefits and care are the things that are not that immediate distress reduction. It's actually going out and facing distress, learning that you can experience it and continue to live your life. And so I think there absolutely needs to be tools that are designed for this.
My colleagues and I often talk about the difficulty of patients who are quite needy. They're alone, they're feeling issues of rejection, abandonment, there's nowhere to go. But people are now turning to general agents like GPT. We often reflect on the fact that a good AI conversational agent is never going to criticize you. It's never going to get tired of you. It's never going to have to want to leave, which is not the case with human agents. How careful should people be about what kind of agent they use just to keep them going in the middle of the night when they want, an AI teddy bear kind of thing?
AI teddy bear, that's beautiful. It did come out that, this whole emotional sanctuary topic was really very much about exactly what you said. It's that space that's unlimited. It's just there for you. It's there when you need it. It's there for as long as you need it. I think when we hear that, we sort of ask ourselves, is that a good thing? Could there be too much of that? Is it just going to agree with me? It's like, if you want it to amplify your delusions, if you want it to only tell you that you're right, then you can absolutely get it to do that. But if you want it to give you a balanced perspective, if you want it to challenge you, if you want it to look through and point out why maybe you're going wrong, then it's going to do that as well. But I think for me, the question is, how do you help people know how to use these things? So I think there's a huge role for public awareness and giving people like just a simple baseline of a few key principles that if they're going to use generative AI frontier models for this kind of thing, these are just some things to bear in mind.
I think one of the ways that digital therapeutics have been thinking about digital mental health as like, we've got a tool for this. And I think there's a lot of flaws in thinking we have a label for something and this is what we're going to provide interventions for. In large part because most people with a mental health concern have more than one. And the best digital therapeutics prior to generative AI in terms of their level of personalization would be like modular. And so you might, for example, get a depression and substance use, or sometimes you'll see PTSD and substance use. I think that's one of the strengths of generative AI is it can really mirror that level of assessment and behavioral strategies that you could do when you see those things show up. Human therapists do this all the time. So I think One of the things that's hard about designing the system for generative AI is you can't just build it for one thing and not other things. And that's part of why it makes it such a hard effort, is you have to design it around so many different areas. It takes a lot of doing. And that's part of why that journey has been so long for us.
Yeah, a couple of other questions that come up asking about people who are in counseling but not highly qualified professionals. Can an AI entity help train them?
We are doing some work in that space. I think it's one of the lowest risk scenarios for generative AI. A lot of folks within their clinical training jump from having absolutely kind of conceptual level exposure to finally they're interacting with their first patient for the real time. And I think that's one of those areas that could help bridge that gap. I think that's definitely a nice application area that's pretty low risk.
It's going to take the whole community to make this the best it can be. And I can make one very clear statement about the future. Based on where we are now, we have no idea what the future looks like, because it's just being more and more amazing possibilities.